Assalamualaikum warahmatullahi taala wabarakatuh. My name is Cik Noriah Osman from UiTM Pulau Pinang. The title of my presentation is Knowledge, Attitude and Health Belief on MBSR for Anxiety and Depression among Cancer Patients in Malaysia, a qualitative exploration. As for an introduction, cancer poses a major psychological challenge for individuals. Studies indicated that the psychiatric disorders in the oncology setting yield 30 to 40% of the prevalence. With the increase in the number of patients living with cancer, a growing number of patients are in need of effective and accessible psychological treatment. This is proven by many people living with cancer opt for traditional and complementary medicines. Some of the most popular are mind-body therapies, including relaxation and imaginary hypnosis, yoga, meditation, and so on. Many people may turn to mind-body as a way to manage stress and improve HRQOL. They believe that what we think and feel can influence our health and healing dates back thousands of years ago. TCM have been started in many hospitals in Malaysia. However, mindfulness-based stress reduction therapy is not yet appreciated in Malaysian clinical setting. What is MBSR? MBSR is a program started by Professor Kabat-Zinn in Massachusetts, America in 1979. Interestingly, MBSR also found written in Al-Quran and are encouraged to be practiced as a way of life to achieve a good quality of health. MBSR program attracted attention in the domain of emotion research, clinical intervention for anxiety and depression, and other clinical problems made these mindfulness-based exercise more popular in the clinical setting. MBSR scenario in Malaysia is brought to Malaysia by Dr. Pang Chenker. It has been tested in many clinical settings, including a few healthcare professional group and counseling teachers, and is proven effective. However, MBSR is not yet tested in cancer patients in Malaysia. What is MBSR? MBSR is an 8-week program, uses a combination of mindfulness meditation, body awareness, yoga, and exploration of patterns of behavior, thinking, feeling, and actions. MBSR is a non-judgmental acceptance and open-hearted body sensation, internal mental states, thought, emotion, impulses, and memories in order to reduce the suffering of distress and increase well-being. Here are some of the support documents to show the effectiveness of MBSR on cancer patients or anxiety and depression. As far as anxiety is concerned in cancer patients, stress, if not treated early, will lead to anxiety and depression, and there are cases of suicide increase as proven by Ms. Sano et al., and it interferes with cancer treatment. Scenario in Malaysia, the available setting in Malaysia in clinical service doesn't provide enough psycho-oncological to support the patient. Therefore, patients with anxiety and depression opt for the NCM to help them with the symptom. MBSR have started in private hospital but not yet in government hospital, and is not yet tested on clinical patient, on cancer patient. Knowledge, attitude, and health belief have been chosen as a topic of my study because it is important to look into, because knowledge, attitude, and health belief will affect the patient decision making on certain program introduced. No study, however, conducted on cancer and mindfulness-based therapy on the knowledge, attitude, and health belief in cancer patient in Malaysia. So this topic is eminent to be explored. Knowledge, attitude, and health belief determine patient's call to action. Knowledge, attitude, and health belief are various among cultural, religion, and socio-demographic and economic of patients, or it is eminent to be studied. Patient's call to action determine the patient comply to treatment program and effect outcome. Aim of this study is to determine the disease state, psychological knowledge, and health belief on cancer and perceived effectiveness of MBSR for anxiety and depression among cancer patients in Penang, Malaysia, in qualitative exploration. So this is the objective of the study, to explore knowledge and to find the type of MBSR used by the cancer patient. This design is approved by the USM Ethics Committee. This is a face-to-face interview conducted and interview based on the information gathered from the literature review, and also the guided questionnaire. The saturation reached at 23rd constant patient. The study tools, this is the semi-structured interview was used. The pre-testing of the interview guide included conducting pilot study was done in few cancer patients before it is used as a particular questionnaire. Specific probes were identified during the interviews. Here are the results, the demographic characteristics. Then the three main categories were identified. There is knowledge, perceived, and the stress coping strategy. And the knowledge, most of the patients revealed that they have never heard of MBSR. And perceived effectiveness, however, they are very positive about MBSR, and they said that if it is offered, they might join, and they have used various kind of stress coping strategy, but the most popular one is the spiritual healers. Here are the results of each of the interviews, and ignorance is one of the options for the patient. So here are the discussion. Many patients are still lack of knowledge on MBSR, even though they perceive MBSR as good and they believe it can help them to reduce stress and induce better clinical outcome. Patients have a very positive attitude toward MBSR and perceive MBSR is good and can help them with their cancer healing. Patients use all types of stress coping strategy to cope with stress. And the conclusion is, this study revealed that MBSR is not yet popular in Malaysia. Education and awareness program on MBSR should be conducted in clinical setting. Cancer patients perceive MBSR as beneficial as far as mental health is concerned. Cancer patients experience tremendous stress and look for all type of strategies to cope with their stress, and they utilize many forms on MBSR without any guidance. So many approaches need to ensure stress management among cancer patients are more effective and ensure better clinical outcome. So thank you very much. That's all for tonight. Assalamualaikum.